Hi, my name is Veronica Nkingafa. I'm your registered practical nurse today. How are you feeling today? So you're feeling very sick with severe headache, dizziness and weakness which is causing nausea, chest pain which feels heavy, and non-productive cough. You also have stiffness of the neck. Before we get started, can you state your last name and your date of birth? Do you know where you are? Do you know what date is it? Do you know what month of the year? Good, you're alert and oriented times 3, which is good. Do you have any allergies?
Yeah, penicillin,
Are you on any medication?
insulin.
Do you have anyone with you today to share your medical condition? No. Good. Before I start, I'm going to check your vital signs in order to rule out any abnormalities. Is that okay? Your
Okay.
blood pressure is 39.7. Your pulse rate is 115 beats per minute. Respiration is 22. And your blood pressure is 115 on 70. Your temperature, pulse rate, and respiration are a bit high. This may be due to the pain or pain that you're experiencing or infection, but we are going to do more general assessment in order to find out what is going on, okay?
Okay.
I'm going to also check your blood sugar because you're on insulin just to rule out any signs of diabetic ketoacidosis, okay?
Okay.
Oh, you said you have headache. I'm going to ask you a couple of questions regarding the headache in order to better assist with the management, okay?
Okay.
When did the headache start?
One day ago,
Provocation. What makes it worse or feel better?
movement and light.
What makes it feel better?
Uh,
Sleeping.
sleeping. Yeah.
Quality of the headache. How would you describe the quality of the headache? Does it feel heavy, stabbing?
It is troubling.
Severity. How would you describe the severity of the headache? On a scale of 0 to 10, 0 being the least
It's
headache and 10 being the
8.10.
worst.
8,
Oh.
8 on 10.
And region. Can you point to where it really hurts?
It's all over the head.
And does it radiate to any part of the body?
It does not spread. I just feel the fatigue and dizzy.
And what time of the day or what time does it hurt the most or feel better?
It's all the time.
And what have you done how do you manage the headache?
I tried Tylenol and Avil and it's not working.
And what do you think can be causing the headache?
I don't know. I just feel sick.
You also complain of chest in your chest pain. I'm going to ask you a couple of questions to assess that chest pain. Is that okay?
That's
When
okay.
did the chest pain start? What makes it worse? What makes it feel better? How would you describe the quality of the pain on your chest? Stabbing, heavy, squeezing, severity. How would you rate the pain on a scale of 0 to 10? 0 being the least chest pain and 10 being the worst pain of your life. And can you point to where it really hurt? Does it radiate to any part of the body like the shoulder or the neck? And what time of the day does it really hurt or feel better? What have you done to manage the chest pain? Are you on any medication?
No.
What do you think can be causing the chest pain?
Oh, no.
I'm going to assess for your respiration, okay? Do you
Okay.
feel any shortness of breath at the moment?
No.
Do you feel pain on breathing?
No.
Good. And I'm going to ask you to raise your hand up. Raise your hand up, hands down. Close your eyes, open your eyes. The spontaneous opening of the eyes and you're responding to command, which shows that using the Glasgow Coma scale, your assessment could be at 15, which shows that there's no neurological deficit at the moment, okay?
Okay.
I'm going to go further to ask you more questions regarding your general condition. Do you feel tingling sensation or burning sensation on your extremities?
No.
Have you had any seizures?
No.
Can you describe your gait and balance?
No.
Normal. Can you describe any incidents of maybe fall or head injury?
It's normal.
Have you experienced any changes in vision or speech?
It's normal.
Normal. Good. And I'm going to ask you about the cough. Is it productive or it's non-productive?
Productive.
Good. And have you seen any blood stain or anything like that when you cough?
No.
Good. And I'm going to also get you to squeeze my hand very tight. Squeeze my hand. Good. Wow, there's good strength of the upper extremities. I'm going to help you to plantar flex and push my hand against the resistance. Okay, go. Good strength. Excellent. You have equal strength on both extremities, which is good. Next, I'm going to assess the thorax for any signs of lung abnormalities like wheezing or crackles. Okay. When I place a stethoscope on your chest, please take a deep breath. Okay.
Okay.
Good. Your lung sounds are very clear, no crackles or wheezing. The vesicular sounds in the middle area were very clear, and the bronchovesicular sounds were very clear in the peripheral area. Okay. I'm going to ask you to turn over so that I listen to the posterior thorax. Okay.
Okay.
The bronchovesicular sounds were heard clearly in the peripheral area, and the vesicular sounds were heard clearly in the middle region. No signs of crackles or wheezes. I'm going to ask you to take a deep breath. Let me check for the thorax, the normal rise and fall of the chest. When the patient breathes in, my thumb separate, and when she breathes out, my thumb returns to normal, which is the normal sign of normal rise and fall of the chest. The skin looks okay, consistent with the rest of the body. The lips appear pink, no sign of cyanosis, and there's no sign of respiratory distress. There's normal rise and fall of the chest. I'm going to give you some Tylenol to help with the pain at the moment as prescribed, and I'm also going to teach you some distractive techniques in order to alleviate the pain for the moment. Okay. Meanwhile, I'm going to consult the physician to get more new orders in order to help you with the condition. Okay.
Okay.
My name is Veronica. I'm calling from F5. With regards to Mr. Kai, he's 17 years old male. He's 17 years old male. He reported with stiffness of the neck, weakness and dizziness, which causes nausea, and non-productive cough. On assessment, his blood pressure is 115/70, pulse rate is 115, temperature is 39.7, and respiration is 22. I've administered some Tylenol for pain and taught him some distractive techniques to relieve pain. I'm recommending that we do some blood work and maybe a lumbar puncture in order to rule out meningitis. Thank you.